Welcome back to Talking Point. Our guest today is Professor Tim Eden. He is an expert on child oncology, and he is involved with a trust, worldwide trust, and he runs a project in many African countries and also in Bangladesh. We were talking about his experience in Bangladesh and the projects he is involved with and the other local doctors. Yes, Dr. Tim. Sorry, Professor Tim.
Oh, happy to be Dr. Tim.
Once a doctor, always a doctor.
Exactly. Yeah.
But some consultants, when they become consultants, they are Mr., not doctors.
The surgeons are Mr. Yeah.
Yes, we were talking about your project and your project at the Bangabandhu Medical University. How does it run? How do you get cooperation from the local doctors?
Well, the local doctors they approached us to ask us if we could help them, and that's the essential core of what we do. So somebody asks us, we know that they were developing a service, they've built up a team. So Professor Afikul Islam there, who's the lead in the unit, wonderful doctor who's managed to bring a team together, doctors and nurses, trying to develop the service. His predecessor, Professor Manan, started that process, but Afikul has now moved it into the new direction. We then want to look at natural links to hospitals in high-income countries. And I was very able, because I obviously know everybody in the UK, right. But also because I was president of the international body, I know other people elsewhere who work. And luckily, we have been able to link University College Hospital, and that hospital includes Great Ormond Street, so it's all the same group, so it's UCH and Great Ormond Street from the UK. Old friends and colleagues there, very keen to do, and both doctors and nurses very keen to be volunteers to go and help training. And also for Vancouver Children's Hospital, and the impetus from that came from a Bangladeshi, Dr. Syed Rahman, who was there, is a health economist who worked in Britain as well before, and he mobilized us in 2010 to go out again to Bangladesh to actually have a two-day sort of seminar, bringing together about 40 doctors and some parents and some survivors of cancer to actually work out what they needed. And we're following that, led by Africa, we're following, and the answer very clearly is to produce a network across the country, not just in Bangladesh. We've got to start, not just in Dhaka, we've got to start in one place and then build out. So we started in BSMMU, and then we're trying to connect to all the 8 regional medical colleges, both in Dhaka and around the country. And the 2 of the National Cancer Research Hospital that deals with, of course, is one of the hospitals with radiotherapy, that actually sees very many of the patients with eye tumours because they're connected to the eye hospital. And also then Dhaka Medical College that sees a lot of the solid tumours, and they've already linked in terms of doing the same data registration, right. And their staff come to the workshops when we run them. Right. Then in Chittagong and Sylhet are the next 2 and Afikul has done a great job by going down recently with a team of his people to help them in Chittagong with a workshop and so on. And we're going to do the same in Sylhet when a team goes out from UCH and Vancouver in December this year. So we're trying to...
Do you actually perform operations?
No. When we go, we're going there to teach nurses and doctors, to help train them, to have seminars. And one of the great success things, I think, in Bangladesh is that many of the patients are being treated very well. They have some challenges, which I'll come back to in a second.
Are we talking about well-healed patients?
No,
well-off patients?
No, not. I maybe should cover that area, because people come from all walks of life.
Right.
And there is a high rate of refusal of treatment or abandonment of treatment. And what I mean by that is they come and they decide, when they've been told about it, that either they don't believe that cancer can be cured, or they can't afford, or both.
Yeah.
So we can deal with some of that, because we can, by subsidy, help them through treatment. And we're beginning to do that more and more, and our project does do that. We'd like, in the long run, that not that external aid, we'd like that it would be money in country or money from the government when things improve. So refusal and abandonment is quite a worry. But once people are in, they get their therapy, then survival starts to improve. So I think that that is a process that is going to take a period of time.
And they pay for the treatment?
They have to pay, and parents cover most. They don't cover the cost of being in hospital. They don't cover the cost of having food in the hospital. They don't cover the cost of most of the basics, basic antibiotics, drips and fluids and so on. But they will have to cover the cost of the cytotoxic drugs. And I think as economies improve, then hopefully more of that will be taken on by health services.
Yeah.
I think that the idea really is when we go out to teach, we're wanting to teach doctors and nurses about the signs of disease.
Right.
We want to go out into the community because that's where you would reduce people coming late and also would overcome the feeling back in the community there that cancer can't be cured, because we have to do that. And the only way to do that is reach out into the community, reach out to local health clinics or clinical doctors, often before you get to hospitals. They've looked at it in Bangladesh, and if you get to a district hospital, it's very likely you'll be referred. You know, that is good. It's at the community level where sometimes patients are missed. And I think that then once you've started some treatment, hopefully we can keep them on treatment and then cure them. But we have to build out right across the country. We're not very interested in...
Where do you get your funds from?
We raise them. that turns to a very interesting point. We do have
all
to
over
raise...
the world?
Yes. We obviously started in Britain, set it up. But we are actually... we have formed another World Child Cancer USA. So we have World Child Cancer in UK, have World Child Cancer in USA, and we may be able to form others. We're in discussion with other countries or continents to think about it. But we raise money from corporate endowment funds, big foundations, individual challenges, people doing crazy things, walking from Land's End to China Groats, triathlons this weekend, all those sort of things. We arrange events in which people will come and pay. We get individual high wealth people putting money into it. We do entrepreneurial work. And we've just been announced that we have actually got the Financial Times seasonal appeal, which will enable us to work with them to get more publicity and to get out there to actually spread the message, really. And we hope that as a result of that, that our corporate sponsors and so on will also increase the income.
Do you also work with Cancer Research UK and Macmillan and all?
Yeah, both of those charities do very wonderful work in Britain, but their mandate doesn't allow them really to do overseas work. CRUK did a little, they helped us when we went there in 2004 to do that. They did help us fund that, but in general they do not, and it's not fair to their donors. They know that somebody else does that. So we don't get money from them essentially. We do have very good relationship with the NHS, and we have a lot of discussions about that, and there's been a lot of, all party parliamentary committee has looked at actually volunteering, and they think it's a wonderful benefit for the NHS within reason and for where we're doing abroad. So there is a report just being produced by them, which we're very pleased with, that volunteering is recognised as being benefit for everybody. When we go to developing countries, we learn something from them, and they hopefully learn something from us.
What is your general experience in Bangladesh? I mean, you get good cooperation from authorities?
Totally.
Of course, the doctors are very helpful, but...
No, I think when we've met we need to do more of that because we actually need to lobby a bit more.
Right.
But no, we've always been very well received, and certainly at the hospital where we work, then we've got very good, and at the university from the top. I'm embarrassed to say, 270 people turned up to a session that we were running there, and it's a bit embarrassing when you have more people turn up to hear you talk than they would do in Britain. It's sort of a very pleasant experience, but I think, yes, including political elements and so on.
Yep.
But we have to do more of that, because in the long run, sustainability must be in country. I mean, we can't. Total reliance long term on aid is very. It's not a good idea, I think.
How do you think this Bangladeshi diaspora in this country and other countries, how can they help?
Well, I think they can help us with a dialogue to understand how we can do more and how we can do better and how we can communicate better about cancer and that's a language problem because, of course, very few of us speak Bangla, so I think we need to have that sort of help. But we're hoping that the nature, I know that people in the UK do donate a tremendous amount of money to go back to the home country, and particularly people from Sylhet, whom most of you here are. And we hope that in the long run, as you see that this might be a threat to children, that some of that money might be put in that direction. That's a sort of bid, a tentative bid, but only when people are willing and realise that it is. But I think it's not really yet quite got into the mindset that this is a problem, because we think of back home as being problems with infection and malaria and diarrhea and so on, but that is going down, and it is being not conquered, but it's being treated very effectively. The time when I went in 2010, there was a cholera epidemic, and there were 800 plus patients coming each day to the cholera centre right next to where we were having our discussions, and it's a very dramatic and very brilliant setup because it was quite remarkable. I mean, the death rate is very, very low, whereas it used to be very high. And so you're seeing that they are tackling wonderfully.
They are tackling. Coming back to our cancer, at this stage, how far are we from making a total impact?
I think away.
Kill cancer.
I think away. I mean, I think we have to keep working as we do step-like. You remember what I said at the beginning, we discussed in the 60s, we didn't expect children to survive, and here we are 2012, 2013 thinking we can cure. In how many years can we get rid of this? Well, eradicate it. I hope that we can actually, I don't think we can eradicate it, I think we can treat it. I think unlike adult cancer, where you can do quite a bit of prevention, I think in children's cancer we've got to treat it well. I think it's going to take us some time, but I think we can. I don't think you should have to wait in Bangladesh for 40 plus years. I think we can move it faster, and I think we are now moving it faster, and that's what we're aiming to do. Because the world is now a global village, and one bit of research here in this country, the results can benefit a lot of other patients in Bangladesh. I think that's very true. I was discussing with one of my closest friends and colleagues who is from India, from Calcutta, and there's a very great possibility of collaboration, and that does not mean patients going to Calcutta, but collaboration from there. One has to remember, okay, political and traditional problems that have occurred, but actually it is a global world, and we've got talent everywhere that can be harnessed to help in Bangladesh to speed up the process. We have come to the last 30 seconds. Can you give us a very optimistic idea on cancer? Optimistic idea is that we all work together, collaborate to make sure that children don't suffer and that drugs get to where they're needed worldwide, and children actually have a chance to be cured. More research to be done? Absolutely. Thank you very much. It was nice having you with us. It was a pleasure and an honor. Absolute pleasure to talk to you. Thank you. Thank you, viewers.
We were talking to our guest today, Professor Tim Eden, an international oncologist of repute, and we have benefited a lot, and hopefully once again we'll have him somewhere here with us to talk more about the developments in cancer research and cancer treatment. Hopefully we'll get rid of this disease that is killing a large number of people all over the world, and particularly children. Thank you for being with us.